of this retinal detachment quiz. I'm ready to do the test. So first, you should know the definition of retinal detachment is the separation of the neurosensory retina from retinal pigment epithelium, which is the inner 9 layers and outer 10th is RP. Inner means towards the vitreous and outer means towards the choroid. Now the first question is regarding which is the type of retinal detachment in a third trimester pregnant lady with bilateral retinal detachment. So in rhegmatogenous, there should be a rhegma means a hole or a tear in the retina. Traction means there are some new vessels on the retina. Exudative means the fluid is coming from the choroid. So in pregnancy, there is increased fluid flow in the blood vessels, increased fluid coming from the choroid from behind the retina into the subretinal space. That is the space between the neurosensory and the RP, causing exudative retinal detachment. That's the answer of the first question. Retinoschisis is splitting of the retina at any level, mostly at nerve fiber layer, outer plexiform layer. Now, Schaffer's sign is a tobacco dust appearance. I told you in rhegmatogenous there is a hole. So from the hole, the retina pigments, retina cells come into the vitreous cavity, spread like a tobacco dust. That is a Schaffer's sign, and this will lead to floaters, a very very important symptom in rhegmatogenous retinal detachment. Now this is optical coherence tomography showing the inner 9 layers separate from the RP, and in between the black one is the subretinal space. And this is nothing but central retinal detachment, that is central serous retinopathy, a type of exudative retinal detachment in a young male with a type A personality under stress, coming with metamorphosia, distorted vision. But this is due to outer blood retinal barrier break, that is the RP and the Brooks membrane complex, and it is managed conservatively. So C is the wrong answer because it is due to outer blood retinal barrier break, not inner. I just told you this. Sub RP means behind the RP layer. Subretinal is a space between NSR and RP. Suprachoroid is a space between choroid and sclera. While hyaloid means vitreous, space between the vitreous and the retina, is a very small space known as subhyaloid space. I told you regarding this in the previous quiz as well. Now, diabetic patient has a tractional retinal detachment because of new vessels. New vessels can pull the retina, causing traction, causing gradual decrease in vision, and then field defects, then vision loss. Now, this tractional retinal detachment comes in proliferative stage because new vessels word comes in proliferative stage of diabetic retinopathy. A diabetic patient wearing thick glasses complaining of floaters and curtain falling from above means superior visual field defect. Means inferior part of the retina might be involved, and floaters means something is there in the vitreous. And that just told you, it has to be something in the vitreous like Schaffer's sign, and inferior retinal detachment is there, that is rhegmatogenous retinal detachment. And thick glasses means high myopia, and myopia has retina holes, lattice degeneration, that is thinning of the retina which can have holes from where the pigments can come into the retina. In vitreoretinal surgery, you take out the vitreous and replace by vitreous substitutes like silicone oil, perfluorocarbon liquids, air, SF6, C3, F8 gases. Sodium hyaluronate is not vitreous substitute, it is a viscoelastic. Can be used in cataract surgery. I told you this in previous quiz as well, if you're following the quiz. Now this is a pneumatic retinopexy. Pneumatic retinopexy means pneumatic means gas. If you put gas without taking out the vitreous, if you put gas in the vitreous cavity, the gas will go up, and it will cause internal tamponade. So it is only for superior retinal detachment, and you have to laser the hole. So it is only for pexy means you have to laser the hole. So it is only for rhegmatogenous and superior rhegmatogenous because gas can go up. Now which gases can be used? 100% gases. Air cannot expand. C3F8 and SF6 100% concentration can be used. That's why air travel is not allowed after this procedure. Now exophytic means the tumor is going towards the choroid. So it is causing retinal detachment due to outer barrier break and nothing but exudative type of retinal detachment. The most common type of retinoblastoma is endophytic, where the tumor comes into the vitreous cavity. That looks like leukocoria. This also due to sequence of rhegmatogenous detachment. Floaters, Schaffer's sign come first, then flashes. Flashes means there is a pull on the retina, and then field defects. So FFF, floaters, flashes, field defect is a classical sequence of rhegmatogenous retinal detachment. I think that's the 10 questions. I hope you have done well. Best wishes.